Excellent, thank you. Hi, everyone. I'm Zachary Goldman from Oregon Health Authority. This is the Sustainable Healthcare Cost Growth Target Program, fourth meeting of the Rules Advisory Committee. While some folks are still trickling in, Christy, let's go to the next slide, please. And for all attendees, please open up the chat feature down at the bottom of the screen and enter your name and organization, if applicable, in the chat. This is a little more efficient than doing roll call, so we can be a little faster at this. Thanks for everyone who's already done that. Let's go on to the agenda. Chrissy, next slide, please. So we're going to cover hopefully a lot of ground today. I want to start with just a high-level kind of rulemaking process and timeline where we go from here. Then we're going to do a deep dive into some specific input that we've heard thus far regarding penalties and some other issues. So we have a lot of slides and time dedicated to that. Then towards the end, we're going to do two things. A quick summary of changes to the posted draft rules, and secondly, draft statement of need and fiscal impact. Now, these documents are required for a rules hearing, so we wanted to post them and make sure folks knew where to find them and reiterate the request for input. And then lastly, we will end with public comment. If you're having any technical difficulties, you're trying to speak, but we can't hear you, you're trying to raise your hand, but you can't figure it out, whatever it is, please send a direct message to Christy Baker. She's helping us with all things related to IT today. So thank you, Christy. If worst case scenario, you can't figure out the hand raising feature, just take yourself off mute and announce yourself. By and large, though, we will use the hand raise feature because I think a lot of folks will have great input to share. And this meeting is being recorded. Let's go to the next slide, please. So just some housekeeping in case anyone didn't know yet. All materials, every comment letter we've received thus far, those are all posted on our accountability page. Here's the link. This is the same page that lists all the different RAC Zoom invites. So it's all in one place, one-stop shop. So everything is right there. Let's go to the next slide. Let me talk a little bit about timing and where we go from here. So let's go to the next slide, please, Christy. So we've had 3 meetings thus far, and we talked about a lot of stuff, which has been great. Obviously, the conversation continues for this one, and then the 5th one in May. We will have a 5th and final Rules Advisory Committee meeting. We're going to continue discussions in May. Just like we've done thus far, we will post documents at least a week ahead of time. And that's mid-May, May 15th. So we'll cover that at the very end. Let's go to the next slide. In terms of kind of where we go, so I just mentioned May 15th. Before that meeting, we're going to post revised sub-reg guidance document drafts, a revised draft rule set, and potentially some other documents in response to whatever we talk about today. So just kind of a TBD right there. The rules hearing will likely occur in June, and public comments, as is required and as is convention, will be accepted at and after that rules hearing. So if folks aren't able to provide comments, for this next week, there obviously will be more opportunity to provide public comment during and immediately after the rules hearing. And if you provide comments earlier, it helps us inform kind of that next iteration that we're going to post for the May RAC meeting. So the sooner the better, and there's plenty of opportunity to provide public input. Seeing a question, briefly clarify who participates in the rules hearing. So the rules hearing is a public process, so anyone can listen in. We will for sure let you all know when and where. There'll be kind of a remote call-in version. And the rules hearing is really a totally open forum for folks who haven't participated in that. There's really not much of a presentation of what it is. It's kind of, does anyone have thoughts about these rules? And any and all can provide. On the OHA side, so I'll be present, maybe a couple other staff members, as well as the OHA rules coordinator. As a reminder, RAC's rules advisory committees are used to seek input to the maximum extent possible during the development of the proposed rulemaking. The RAC's role is advisory, consensus is not necessary, and we appreciate you all being here. Let's go to the next slide, please. Just to ground us, I know we've been talking a lot about kind of the wonky bits and the nuts and bolts of accountability, but just to ground us, there are kind of three, dare I say, layers or three kind of components of Oregon's accountability mechanism for the cost growth target. One is transparency, right? Public reporting, public hearings. The second is performance improvement plans. We've talked a lot about this in previous RAC meetings. And the third and ultimate is financial penalties. We're going to be talking about this today for payers and providers that exceed the cost growth target with statistical confidence without an acceptable reason in any 3 of 5 years. As a reminder, we apply that statistical confidence on all our analyses, and we apply that kind of acceptable reasons framework on all instances of being over the target. Just responding to some comments here. Yes, for written testimony, yeah, so written comment is completely fine for the rules hearing, if that's what the question was about. Okay, let's move on to the next slide. And so now we're going to get into the kind of main topic here. We want to raise some very interesting input that we've heard thus far. The overall structure of this meeting, I'm going to present, you're going to hear my voice a lot, sorry. So you're going to hear me for a while, and then we kind of bifurcated the presentation. So Sarah's going to pick up the latter half or so. But as usual, we're going to be kind of somewhat fluid and tag team a lot. But this first chunk is mostly me. Before we're jumping into the topic, so I do want to elevate the fact that we received a lot of great input, some of which was in direct opposition to another input, and not necessarily along the kind of industry advocate dynamic. Sometimes it was multiple comments from industry that were in direct opposition to each other. So this is a good opportunity to just raise those different opinions and to talk more about them so they can inform the rule development. So let's jump in. Oh, Sarah.
Sorry, can I jump in with just a little bit more framing here? So for this section, we are going to sort of for each category of input or issue, we're going to summarize the feedback at a very high level that we received in the public comment over the last couple of weeks. And then we're going to either share how we've made changes in the draft rule or the changes that we're going to make to the draft sub-regulatory guidance, or we are going to explain our reasoning on things, or we are going to propose some additional changes and proposals for your input. So this is going to be a combination of all of that. So we really want to space it out and tell you what we heard, how we plan to address it, and then hear what you think about that. So just to give structure for all of this, I think we have some natural breaks for feedback. So feel free to enter feedback in the chat log the whole time, you know, if you don't want to lose track of a thought, but we'll pause. We're going to sort of group them. We'll talk about penalties first, and then we'll stop for discussion about the proposal.
Yeah, that's exactly right. And specifically, we're going to kind of talk about the financial penalty and then calculating the penalty. We have maybe 3 or 4 slides on the calculation itself. And so I'm going to clump those together, ask for some grace to get through those, and then open it up. If there aren't any process questions, and I'm not seeing any hands or anything in the chat, I think we can jump right in. Okay, Chrissy, let's go to the next slide. Okay, great. So again, starting with the financial penalty, we received a lot of feedback recommending that we change the name. The name restitution has very specific meaning. Also heard some opposition to directing funds towards the basic health plan fund. And some advocated to only have a penalty paid directly to the state, specifically the state general fund. Others recommended only paying consumers or investing in the community. So this is a perfect example of different input coming in saying, no, go this way, no, go that way. So these are in kind of direct opposition. So the proposal is to remove that restitution language, instead rely just on the word penalty. Secondly, remove the basic health plan fund component of the penalty entirely. So only have the penalty that directly benefits consumers, patients, or community. Only that component would be the penalty. So there'd only be one component. It wouldn't be bifurcated to some dollars go to the state as a BHP fund earmark and others go to the community or consumers or patients, it would just be that latter. This change effectively reduces the penalty amount, right? Because it was two components, now one's gone, it's just that second component. No funds would go to the state under this. We're going to talk about, so the reason it reduces the amount is because let's assume for a second that kind of the methodology for calculating each of those components remains the same. By just taking one off the table, that's dollars that would have been calculated and would have had to been paid to the state. That's just no longer part of the penalty. So just by the nature of, one is less than two kind of thing, if those two components are the same value.
And I want to jump in here, I think, to Matt's comment in the chat. Some of the proposals that we are about to make in this section reduce the penalty and some increase the penalty. So part of that grace and bear with us, sort of, hopefully you can consider this as a package, because there are multiple levers based on all of the changes we're about to talk through.
Yeah. Let me get to the next few slides, because I'm sure folks have thoughts about this, which I want to welcome. But just give me a couple minutes. Let me get through, I think it's 3 slides on calculating the penalty, and then I want to open it up. Okay, so let's go to the next slide, please, Christy, and let's get specifically into calculating. So commenters requested, considering the years that an entity's growth is below the target when calculating the penalty. So if they're only at, say, 2% growth, that should somehow inform something, either the triggering of a penalty or the penalty calculation itself, etc. So the proposal here is, instead of referencing only the years in which the entity exceeded the target in the calculation, the penalty calculation would include the net overage and underage. So if you're over 3 years, which is the case, because you have to be over the penalty, over the target in 3 years in order for us to even be talking about penalties. If you're over the target in 3 years, but in those other 2 years, you're drastically lower than the target of 3.4%, then kind of what's the net overage over those 5 years? So the proposal is that in the calculation of the penalty, not the triggering of whether a penalty is happening, but the calculation of the penalty amount, we would consider all 5 years, overage or underage, up and down. So an entity's cost growth below the target in a given year would help to counter the cost growth above the target. Again, in the calculation of the penalty, right? We're already in a frame of a penalty is happening, which is just a matter of how many dollars are we talking about for the penalty. So this change may reduce the penalty amount, but it depends on how high up and how low down a given entity's performance is. And secondly, and I think this is a really interesting point, this change increases the incentive to continually strive to meet the cost growth target, right? Because if let's say an entity is 3 years over the target, well, they're already in penalty land. Year 4 and year 5, is there much of an incentive to meet the target? Under this rubric, there would be, because if you're actually below the target, that would lower the actual penalty amount dollars that we could potentially be talking about. So that's one thing. So let me get through it. Just a couple more slides, and then I want to open it up. Chrissy, let's go to the next slide. So the second piece of this is to ensure, and commenters requested that the penalties be higher to ensure they are meaningful. And I'm seeing that in the chat right now, actually. So here, the proposal is that deflator minimum. Remember when we talked about last time, it's like, okay, how much overage are we talking about? It's X number of dollars. The first infraction would be 1% of that overage, and that would be the penalty amount. And then if there's another penalty in however many years, then it would be 5%. If there's another penalty, then it's 10%, and that kind of graduated deflator. So instead of a 1% first time minimum deflator, it would be 5%. So instead of 1%, it's 5%. This change increases the penalty amount, and again, as kind of a counterbalance to the many other proposals here that we're offering that would decrease the penalty amount. So that's the second thing. Let's go to the third thing. Christy, let's go to the next slide. So some commenters requested some clarification, given year only counts once up and down when calculating penalties. Commenters requested a clarification whether 3 years over the target must be consecutive, year one, year two, year three, versus year one, year two, year four, and whether the penalty window is in fact 5 years. So the proposal here is that, and this is actually what we had intended all along, but we just want to make it abundantly clear. A given year's performance above or below the target only counts once for penalty amount. So if you're already penalized for 26, 27 performance period, sometime, obviously in the future, then, there's only, that entity is only gonna be penalized once for that performance period, in terms of calculating the penalty. And on the other side, if we were to adopt that net over underage, if someone's at 2% and there's a difference between 3.4 and 2%, they're under it, then that benefit of that year would only be counted once too. So the intent has always been, and we want to make it clear, that a given year's performance above or below only counts once. There's no double penalizing for a given year's performance. Secondly, the 3 years over the target does not have to be consecutive. It doesn't have to be year 2, 3, 4, or year 1, 2, 3. It's just 3 years within a 5-year period. It can be any three, but it's three, at least three. And that 5-year period is rolling. It's not the case where it's 2025 to 2030, and that's the 5 year, and then you have 2030 to 2035, and that's the 5 years. No, it's 5-year increments. So that's kind of how we always intended to structure it, and the comments we received asked for that clarification. Okay, I think that is the next. We're going to talk about penalty within a market, but let me pause here. Actually, Chris, sorry, let's go back to the last slide. Yeah, let's stay on kind of penalties, calculating penalties themselves. If folks have questions or thoughts, feel free to raise your hand. And I'm going to filibuster for a moment so I can read the chat and see what questions I can answer here.
We've got Bill Kramer's hand up, and then I think Matt has some questions in the chat. So let's do Bill, Matt, and then Andrea.
Perfect. Bill, please.
I have two questions. They're related, I think. First question, just to confirm that the objectives for the financial penalties, that one objective is to provide compensation to patients, consumers, and purchasers who have had to pay the higher costs, and two, to provide an incentive to entities to meet the targets. Is that correct?
Yes.
Okay, great. And so second question is, what kind of analysis has been done to estimate the degree to which the proposed formulas would provide an effective incentive to entities to meet the targets?
Yeah, that's a great question. So we have done some modeling on just the years of data that we have, which, as a reminder, COVID, a lot of other supply shocks, high inflation, we kind of granted everyone that said those are all acceptable and justifiable causes of cost growth. That said, just taking the raw data values, we've looked at these proposals relative to that cost performance. And by and large, I mean, the penalties range, obviously, depending on a number of factors, size of the entity, how far over or under the target they are. And given these newest proposals of taking kind of a net effect, some entities whose penalty was higher are now slightly lower. And the converse is true. It really depends on how far under or how far over they are. Bill, to your question about kind of, does this adequately respond to the high costs that a consumer or patient or member is experiencing? That's hard to see in the modeling, just because
Zachary, can I jump in on that? Because I want to be
Sure.
clear. We have not explicitly modeled the penalties relative, the proposed penalties relative to excess patient cost sharing or cost burden. We have not done that as an exercise. But I want to pivot actually to what I think, what else Bill said, which was will the penalties, or, how high do the penalties need to be? How large should they be to be motivating? And I want to remind everybody that in public comment, in previous committee meeting discussions, we have had a lot of varying opinions about what is motivating. We have had payers tell us that the existence of a penalty, regardless of how much it is, the fact that they would be known as a penalized entity is sufficiently motivating by itself. We've had multiple proposals saying that the penalty should be capped at $10,000. Should we interpret that to mean that payers and providers think that a $10,000 cap is sufficiently motivating? We've seen that it should be a lot larger in comments. And so I don't want to speak for any of the entities, the payers or providers, about what they would consider sufficiently motivating, because we've received such a diversity of response to that question.
Great, thanks, Sarah. That's very helpful. I guess the question I was asking is, I understand there's been public input, or input at least from these stakeholders on the RAC, about what the what the financial penalties should be. And some of them made comments that, yes, we think X would be sufficiently motivating. I just wonder if there's some independent analysis that's been conducted by experts, perhaps looking at experience in other states or in other mechanisms where there is some kind of financial incentive for achieving cost growth targets. Has there been some kind of analysis like that been done?
So I will remind everyone that we are currently the first state with financial penalties for exceeding cost growth targets. So there is no other state experience that we can learn from here, unfortunately. I think we have been looking in the literature, and we've talked to some experts about financial penalties in other industries and what is considered motivating. And again, I would say, and this is my personal opinion, the range really varies. And it depends on what you're looking at, and it depends on the entity and the industry. And I don't know that I came out of that exercise or found any single expert that said, like, this number or this percent is sufficiently motivating, sort of as a metric. That doesn't mean it's not out there. I think if Bill, you or any other RAC members have suggestions of experts who might be able to inform this kind of work, I would love to know that. But I think based on some of the literature review we looked at, some of the work in other fields that we looked at, I did not come away with that with an understanding that there was an agreed upon answer.
Great, thanks. That's very helpful. Thanks, Sarah.
I think, so I lost track of who had their hand up first, but let's go to Andrea, then Matt, then Paul, then James.
I think Matt was first. If you want to go ahead, Matt. Okay. Well, a couple of thoughts. One, piggybacking on Bill's comments. I mean, I think, we acknowledge that part of this program's accountability mechanisms is financial penalties, and that those do need to be motivating in order to be effective as an accountability mechanism. That said, Sarah, to your point, we are the first state that has done this. And so, we are one of the commenters who recommended a $10,000 cap as a starting point. And the reason for that is that this program is so new. We are the first state that has done this. The cost growth target program has a lot of different mechanisms to achieve the overall goal of reducing healthcare costs growth for consumers. The accountability piece, and specifically the financial penalty piece, is just a small one. And we don't have evidence at this point that in the grand scheme of this program that financial penalties are going to be the thing that successfully contains cost. And in fact, we do have evidence to the contrary, right? That if you raise the cost of operations for healthcare entities, that healthcare costs could go up, and that's counter to the goal of the program. So, our recommendation is rooted in the newness of this program and the fact that, we want to limit the possibility that this program could ultimately counter its goals, right? Limit access to care, limit investments in the workforce, and ultimately increase costs. So we feel like, that $10,000 cap is a reasonable starting point. And then if we find later on that higher penalties would achieve the program's objectives, then we can have that conversation. I also want to go back to the calculation of the penalties with the net overage and underage, that's something that we recommended in our comments previously, and so we support that approach. One clarification, though, I'm wondering how that squares with the other proposal that a given year's performance only counts once. So if you're calculating that overage, underage over a 5-year rolling period, like if you get penalized more than once within 5 years, it seems like you would still have some of that double counting. So I'm wondering if the clarification is just that if a second or subsequent penalty occurs within 5 years, it would be calculated based on the net overage, underage since the last penalty.
Right, since the last penalty. That's right, right. That's
Okay,
right.
thank you.
Yeah. And regarding your previous point about the $10,000 cap, so we did some just quick analysis looking at total revenues. We wanted to get a feel for what would the salience of a $10,000 penalty be for some of the largest entities, because we have a wide range of smaller, medium, large entities who are accountable under the program. So when we look at a $10,000 cap for a given 5-year period, for some of the largest provider organizations, a $10,000 penalty would equal 0.0001% of revenue attributed to that entity. Just by way of like context and kind of what that means, to apply that percentage to, say, medium household income in Oregon, which is about $87,000, that would be like a fine or a speeding ticket. We've talked about that, of 43 cents. So just by way of kind of background and context, maybe that helps kind of calibrate these larger numbers. Let's hear from Matt.
Sure. First of all, thank you for, I think, trying to thread the needle here. This is a challenging exercise, I'm sure, especially when there's not a lot of consensus on penalties. And I actually appreciated everyone's input. I think, for our purposes, one of the things that we are really trying to do here is also incentivize compliance. So what compliance means is, taking approaches, innovative approaches to try to limit the growth of the cost of healthcare. I think, as we've seen in some cases, PEB being one, where we do have a hard cap, an actual rate setting process, if you will, that it does force us to make some tough choices and behavior changes and try to really do what we can, because Oregonians are just struggling to afford their healthcare. What I always struggle with when trying to pick a number, so I think, the way I heard it in one of the letters is, this is kind of a matrix of penalties, right? Is that there's a certain amount of randomness to it. I think that we are trying to figure out what is the right number, and what I fear about going too rigid on, say, a fixed percentage here, a schedule, if you will, is that can be also as easily costed and, incorporated into pricing. And then for some payers, different payers or providers have different wherewithal to absorb or deal with that cost. A large national carrier, Oregon may be kind of a rounding error for them. They could very easily go above the target, pay the fine, and continue to absorb market share and really disrupt other payers. So I think something that concerns me is that in this scenario, as I understand it, and correct me if I'm wrong, I don't think OHA would have a ton of discretion to look at some other factors for the behavior of the entity that is being penalized. So if somebody is, generally trying to do the right thing, they just do accrue a penalty because they're off by a minor amount. So it does seem like we may have some ability to go down, I think, in this proposal. But if someone is flagrantly going outside the target, way out of market, they're a huge player that impacts everybody in some ways. And is there ability of OHA to add penalties or add something? Because I think, for in those cases, a fixed percentage, they may have just budgeted for that. It's part of their strategy. They can absorb it, and that's still disrupting that. So I am concerned about how that rolls out. I do think there needs to be, I don't know if we'd call it a safety valve or some sort of aggravating factor that OHA would have some discretion to use in those cases. And I'm also uncomfortable with I think I understand the dollar amounts and some of the ideas around caps. I just think some of the numbers I've seen are quite low, and I think would just be absorbed into the pricing structure and negotiations in our market. And then I had a question actually up in the chat. I just want to flag that's in there, kind of asking about that. Like, I'm a little confused on how penalties accrue subsequently. So if I have like this 5-year period and I'm penalized, does that mean I have to wait until the next 5? Like, how does that work?
Let me
Yeah.
jump in on that one.
And you
So-
can write it if it's easier, because I feel like it might be something where I almost need an infographic to understand how it works.
Yeah, and so Zachary mentioned other documents. I think some actual like writing this out and providing some of the how it works in each years and showing the rolling nature and the over under could be something we provide as follow up. Sounds like that clarity would be useful to a number of people.
Yeah, we can provide that. Thanks, Matt. Let's hear from Paul.
Thanks. And yes, I'm one of those people. And sort of the recommendation is, can we just get like a 10-year view? Entity misses 5 times, it has some years below, and we can just really see, because I support the words you have here. It's still just not clear to me how it would actually work. And so having that long period of time, you could see the escalator in place, you could see the over under in place, and I think that would just clear up a lot of questions. Thanks.
Yep, appreciate that. Yep, we can provide that. Thank you for raising that. Let's hear from Tara and then Nick.
Hey, thanks so much, and appreciate the responsiveness and changes that you've all made to comments to date. A couple things. When we looked at the one sample calculation that we'd seen prior to this meeting, the numbers, when we tried to run them on our own end with a larger scale, those, if we're understanding them correctly, those dollar values for those penalties were quite punishing. And so trying to get a sense, if you've run those numbers yourselves, or if you'd be willing to run those at kind of a medium scale and a larger scale entity, and echoing some of those comments made earlier where there might be national carriers who, for example, have a small market share in Oregon. I think the impact of penalties to an Oregon institution that its predominant market share is here is going to feel quite different. And so hoping that we can find a mechanism that takes that into account. Also looking at entities that operate with a small kind of operating margin, recognizing that some of those penalties can be, like I said, quite punishing. And so, while recognizing that a one-size-fits-all cap might not be appropriate, and that is something that we recommended both from the health plan and our provider side of Providence, finding some space, maybe kind of a tiered cap depending on size a little bit, still could be something warranted so that we can kind of budget for the potential. And then also wanting to, wanting to make sure that I went over all of my notes before I let go. I think that's it. Yeah, running those calculations with realistic patient or membership numbers for entities larger than kind of that small size that was run previously, I think would be meaningful. Thanks.
Great. Thanks for that input, Tara. And I was going to bring this up later in the presentation, but one thing we could provide is a calculator, calculator. It's kind of a spreadsheet that if an entity were to put in some values would spit out a number, right? So not quite a perfect model that's going to grab every kind of potential iteration or all the details, but just kind of a rough cut calculator. We could provide something like that if that's going to be helpful.
I want to jump in, and I have a question and then maybe a request in response to Tara's comments. So as we've been thinking about some of the modeling that we've been doing internally and understanding the impact on different markets, different types of payer and provider organizations, different size payer and provider organizations, I think I have a lot of interest in wanting to provide some of that and show more of that range. I think I'm also very sensitive to if any of that is based on confidential information that we have not released in our public reporting, and not wanting to release that in a way that is currently identifiable. If you remember from the cost growth target baseline data, we collected calendar years 18, 19, and 20, and none of that data was publicly released at the state, at the payer or provider level. It was only released at the state and market level. So if we're using that because we have multiple years to create some of these models, I'm really sensitive to releasing information that we have promised that we will not release. And so that someone could backtrack and say, well, clearly in the model, this is Providence. Clearly in the model, this is Kaiser. So I think I'm hearing, and I heard at the last RAC as well, really strong interest in seeing more of that. And I almost would ask the entities, some of you, would you give permission to release that? I think we'd feel a lot more comfortable, and then we could provide some more granularity about what these penalty models actually look like in real scenarios without trying to make it so de-identified and aggregate that it loses meaning given all the variation across the system. So let me know what you think about that. And then maybe request, I hear what Tara's saying in terms of the, and in the chat too as well, the comments about there should be some cap. I think tying back to Bill's comment, this is the point in the conversation in the rulemaking process where hard numbers are helpful. $10,000 seems very low. How does $100,000? How does $1 million? Like if we're going to talk about a cap, it would be very helpful to have numbers and proposals entering the conversation so that we can weigh that in. Because if you're saying, okay, not $10,000, how about $15,000? That's a very different conversation than if you're saying, okay, well, a $1 million cap or $10 million cap. So I request, to the extent that you're comfortable and able, numbers in the conversation are helpful.
Let's hear from Nick and then Rick.
Thanks. And so first of all, just similarly want to echo appreciation for a lot of the changes you've made up to now and based on the feedback. And I know this is, I know it's been a lot. So I think one, I'd like to kind of highlight, and I just kind of want to double down on your comment about the range, right? Like, so I mean, Zach, you gave an example of the, you know, what $10,000 means to a large group, but like the smallest, I'd love to hear the same on the smallest groups in this group, right? So, I mean, our initial, some of our back of the napkin stuff easily gets to the $1 million, which for an independent primary care practice group is like devastating, right? Like this is completely unsustainable. And primary care is the one thing we know lowers total access to primary care is the one thing we know lowers total cost of care. So, I mean, again, I think to me, it's really important to remember that fundamentally this whole thing is structured around primary care, which is the one thing we're trying to preserve in the state, and we don't have enough of. And I think similarly along those lines, I have significant concerns about the Medicaid, Medicare piece, because those lines of business are even harder to, you know, I mean, practices are already reluctant to take those. I mean, it's already, you know, you look anywhere on social media, anybody with fee-for-service Medicare trying to get into primary care, they can't, right? And so if people feel they're more at risk, I just worry about the impact of challenges along those lines of business impeding access for already marginalized groups, right? So, and I know that's a big change to look, you know, thinking about taking out lines of business from some of this, but I want to think about those lines of business as already vulnerable populations that could be, you know, people can say yes or no to, and there could be some significant impacts to that, especially again on the primary care front, and especially on the independent primary care front. And I think it raises to me though slightly big, like I feel like up to now we've taken the program feels like it's accelerating so fast in sudden, like it's almost like a logarithmic acceleration in terms of the implementation, right? Like started with just, you know, collecting data and then sharing data individually. And now, you know, we're kind of in the public, you know, data sharing phase. And now we're kind of going 3 steps down past the reasonableness, the, you know, figuring out the, you know, the accountability, the PIP, and deciding on penalties, when it's so hard to know what these how those next 3 steps are actually going to go in the real world. And I think that's, at least personally, that's where I struggle with trying to kind of have a good, clear sense of what an appropriate penalty is. Given my somewhat lack of faith, that I don't know that I've fully can clearly conceptualize what it's going to look like after we've gone through those next few steps, and like when we're actually going to be talking about it. I don't necessarily have the trust, to be honest, right? And so I don't know if this is like, I think, and for that, because I fundamentally would advise the caution of like, let's start, we can always turn it up if we need to, but let's maybe build in that ability. But to commit to something that could be catastrophic to an independent, primary care practice before we've gone through any of this other process, let's start low, go through those processes, right? I mean, at the end of the day, our goal is the same, is to get to that lower cost of care. Let's go through that process and see how well that actually works or isn't, and then figure out, do we need a bigger stick? Because ultimately the carrot, in the best of worlds, we're working on carrots here.
Nick, thank you so much for that comment. I do want to ask, and this is a place where I think we've received conflicting feedback from people, and so I want to call that out.
Yeah.
I really hear what you're saying about the acceleration, and I can imagine how stressful that feels sitting, where you are as a provider. We have also heard that the uncertainty and the unknown and not having the penalty plan or the penalty formulas baked causes a significant amount of stress and anxiety and uncertainty. And so I think we said we would do the rulemaking, including PIPs, penalties, reasonableness now at this point in time to split the balance. So I want to reflect that I hear what you're saying, and also put out there that we are also hearing a lot of uncertainty and anxiety that this is not yet developed, and that putting it off even longer might continue to cause that anxiety.
I'll just say, I'll take the likelihood of multi-million-dollar stuff. I will take the anxiety of uncertain, like undefinedness. To me, that feels much more reasonable to say, we're going to develop these processes and see how often we even wind up close to the penalty stage. Because I mean, I again, I know there's a lot of good faith here in terms of like going through the reasonableness process, and this really should only apply to bad actors in this sense, like really kind of intentional bad actors. I don't know if I believe that yet, honestly. Like, having spent much of a career looking at cost of care, implementing processes to try to lower it, I feel like understanding what that actually looks like in the real world. I mean, so much of it sounds great on paper, and then I think when you get into the nitty gritty of thousands of lines, claim lines, where like nothing, the ideas start to fall apart, and you're looking at this stuff going, what's going on here? It's hard to see all the way down that path, and having committed to a structure that could lever, again, millions of dollars onto an independent primary care practice that's kind of barely getting by, which many of them are. They'll all sell it to Optum, and Optum can write out anything. So,
thanks for those thoughts and comments. Yeah, I appreciate those, Nick. Let's hear from Rick and then Elizabeth.
Thank you, Rick Blackwell, Pacific Source. I think probably a little perspective. I come from a background of an agency that did some significant enforcement actions. In the normal contested case process, you can waive or reduce fines through the negotiation with a person that's subject to a civil penalty, provided they're doing something that you'd like them to see. I don't foresee OHA assessing the full penalty all the time, because civil penalties are really it's a proxy for leverage, right? So you're really trying to achieve compliance with the statute first and foremost. These aren't revenue generating exercises. So I'm not entirely convinced that setting the bar low is going to be helpful, because as we noted in our letter, then you simply can add in the cost of what that penalty might be, especially if you're of the means to pay it. So I think you want to go higher, but you want to have the ability to work with someone in the contested case process to say, look, we're going to waive this portion of the fine or whatever. One thing I'm also noticing about this structurally is that you only have penalty authority, I think, as far as an enforcement mechanism. Like, so I came from DCBS. DCBS has a lot of additional tools beyond just a civil penalty to assure compliance with the insurance code. It's not quite the same. So you may have a $10,000 penalty or a $100,000 penalty, but you're also required, because it's 10,000 per violation under 731. In addition to that, there's usually a list of conditions: cease and desist, probably restitution. There are some tools that are missing from your toolbox here, OHA, that the other agencies typically have in these situations. So I think the penalty is going to have to be, you're going to have to look at a penalty as a higher amount to kind of make up for the lack of tools that you have. I don't know if that made sense. More of a comment, but I think we're missing a little bit of admin law in this discussion.
Thanks for that, Rick. Yeah, I appreciate that. Let's hear from Elizabeth.
Yeah, thanks. And I should remember never to go after Rick Blackwell. Elizabeth Edwards, she, her pronouns, Kaiser Permanente. Following up on what I put in the chat, and also just wanted to add my voice to the chorus that really wanted to thank the state agency for the thoughtful incorporation of feedback. I know that there's tension, like you referenced, and you're trying to balance a lot of different puts and takes in this space, and even folks that you think would be aligned, you're seeing some different suggestions come out. So I just want to acknowledge, like, you all have gone through a very thoughtful process in this space, and it's a difficult conversation, and I'm glad we're having it. You know, I put in the chat around a desire to see some not to exceed language, and thinking about how that could be tiered or sized, right? To have a cap, but have it be appropriate. And to address Matt's question, I mean, I am not envisioning that there's some scenario where a payer provider has gone so far out, but maybe that does happen. In which case, I think we're having a conversation about, okay, does this get revisited, right? If there is some sort of abuse that's happening in here, the state can come back and take another look at it. But I think to assume that that's going to happen from the jump is kind of a difficult place to begin this conversation. I think providing some assurances would help if we had some not to exceed, just so that we could understand, you know, how far this could or couldn't escalate at the end of the day.
Appreciate that. Yeah, thanks for those thoughts. These are all really great points and really good input. Let's round out the discussion on penalties before we move on to performance improvement plans. I think folks may have some additional thoughts too, which would be great. Chrissy, let's go to the next slide. Let's talk about one other kind of nuance, which is that we received some comments from a couple different folks requesting that the penalty deflator, this is kind of a term that we just kind of made up for this meeting, but it's that 1%, 5%, 10%, that kind of escalating thing, be limited to the given market. So for example, if an entity was penalized for their commercial market multiple times, so let's say we're 15 years in the future, 20 years in the future, and there are multiple penalties for the commercial market. But then for the first time, this entity exceeds the target with statistical confidence, without a justifiable reason, in 3 out of 5 years, in their Medicare Advantage market. For the first time, that penalty deflator should be that lowest, that kind of starting deflator, right? And the clarification here is that, yes, this was the intention the entire time, and we can add some language to the rules to specify that. Let's go to the next slide, and then we'll shortly turn to PIPs. So for timeline, we received some comments that penalties should not go into effect until the rules are completely finalized. That practically, that would delay implementation of the penalties. And just by way of background, penalties were previously delayed by 1 year due to COVID, and published materials since 2021 have included when penalties would take effect. So there's always been this very clear, very transparent process in which OHA was saying when penalties would go into effect. And there was a delay. There was a 1 year delay due to COVID. So the proposal here is instead of a 2020 to 2021 performance as year one of the 5-year penalty window, 2021 to 2022 would be year one of the 5-year window. So this shifts, this change delays the first potential instance of the penalty to after the 2025-2026 performance. The 2021-2022 determination of reasonableness, all those conversations, they would not occur until after the RAC meetings have concluded anyway. But this, the request was to delay it effectively 2 years. What we're saying, and at the same time, advocates are saying this is a crisis now. We need real accountability now. So the proposal is to strike a balance, delay 1 year. And given the fact that the conversations with entities about reasonable growth that are happening for data submitted, those conversations won't happen until after our meetings anyway. Let me pause there and see if folks have thoughts about either this slide or the previous slide. Yeah, Tara, go ahead.
Hey, thanks so much. We're one of the commenters on Providence who raised this issue. And in part, we raised it not because we weren't on notice of potential penalties, but the scope of penalties that have been proposed is a lot more significant than we anticipated would be proposed. And so, and that was really the request for the delay. We do appreciate the 1-year extension. I'd want to take it back to folks and kind of see as we look through finance how much that kind of supports, but where we do have the 5-year look back and some of the grace that that provides, I anticipate that this is kind of a reasonable balance.
Thanks for that. I appreciate that. Bill, let's hear from Bill.
I understand you're trying to, quote, balance the perspectives, and you've gotten input on both sides. I just want to make sure that we're talking about the right balance here. I'm noticing comments in the chat, which I would like to reinforce that this really is a crisis, an affordability crisis today. The number of patients and consumers who are suffering from medical debt now is way too high. The affordability crisis is happening right now. The number of small businesses who are able to afford to offer health benefits at all has been declining continuously because of costs. And I understand it's hard to make change for hospitals and physician groups and health plans and health systems to make change. But we've all known about this crisis for a long time. We also know what needs to be done and should be done to keep costs slower. So anything that delays, this is already a stretched out program over 5 years. Anything that delays this further, seems to me it's balancing this, what I call somewhat technical point, against the affordability crisis faced by hundreds of thousands of people in Oregon. So I would ask you to think about the balance in those terms rather than simply the balance of input you've received from stakeholders on this RAC.
Thanks for that, Bill. Yeah, I really appreciate that point. Let's go to the next slide. And I talked about this previously, and so here I just kind of want to land this. Would it be helpful if we were to publish a penalty calculator based on the concepts we talked about today? And I think that's different than some of the other documentation that folks have already requested, which we can comply with, and we can put things together to say kind of how does this rolling 5-year thing work? What is this net overage, underage? I think we can provide kind of the narrative form. Would an additional Excel-based penalty calculator be helpful? If not, that's okay. If so, it'd be helpful to hear that now so that we have time to develop it. Any thoughts on this point? I'm seeing one thumb up, a couple other nods. Yeah. Okay. So at least it'd be helpful for a few entities. Okay, that's really helpful to hear. Thanks for that. So where do we go from here? So we're going to talk a little bit about performance improvement plans, as well as some frontline worker costs and other reasonableness. But any other, and it's not final points, but any other thoughts about calculating
Zachary,
penalties and what we talked about thus far? Yeah, Sarah, go ahead.
there's a question from Matt to clarify the reasoning behind the 1-year delay. And from my perspective, it's not either of those things that you're suggesting. It's not because of COVID, and it's not because the penalties might be higher or lower. It's not about the amount of the penalties. It's because we have not yet gone through the process of determining reasonableness for any of the years that have happened. And so the request, as I understand it, the real justification behind the request is entities should not have to go through that process until the rules are final in that whole process and what the reasons are baked. And so when the rules are filed in June, then we will have the determination of reasonableness for the first time period that would count toward that 5-year window. In the current timeline, without this proposed change, this is year 2. And so as part of year 2, we've basically said year 1 was COVID and nobody will be held accountable for COVID. But this would be year 2. And the concern that we've heard repeatedly is that we are holding entities accountable for years before the reasonableness guidance existed.
Got it. Thank you. I heard a few different things, and I was trying to figure out what the appropriate. I tend to follow some of the comments from Bill, but I also wanted to understand a little bit more about because I heard a couple of different things. I heard something about, well, is it a cost issue? And it's like, well, that may require a different sort of response than COVID than what you said. So thank you for that.
That was not a factor in our revised proposal.
Right. This is more kind of a technical piece. Okay. Great input thus far. Let me hand it over to Sarah, and we're gonna dive a little into performance improvement plans, and then to frontline worker stuff.
All right, next slide, please, Christy. Okay, so talking about the performance improvement plans as well as indeterminate cost growth. So for the 3rd RAC meeting, we had introduced a change that said that cost growth could be determined good reason or acceptable reason, not an acceptable reason, or indeterminate. We received a lot of feedback about this and clarifying what indeterminate means and whether or not an indeterminate finding triggers a PIP and triggers or counts towards the 3 out of 5 years of a penalty. The previous draft of the rules and the proposal from the 3rd meeting was that if cost growth was found to be indeterminate for 2 years, a PIP still could be triggered. So we are revising that, and our proposal now is that we are going to add language specifying that cost growth, finding that cost growth is indeterminate is something that should be a rare occurrence. So I think earlier we were trying to mitigate some of the risk that maybe, I'm say this bluntly, acting not in good faith and saying like, there's no way we can possibly figure this out. The data are just too complicated. It has to be indeterminate. And so we want to be clear that indeterminate is really rare. And if it is truly indeterminate and that's where we land, there will not be a PIP tied to that. And that an indeterminate finding would not count towards the 3 out of 5 year penalty trigger. So this change does reduce the likelihood of penalty because it's possible that if a year is indeterminate, it's no longer counting towards that 3 out of 5, but it likely reduces the administrative burden because entities are not necessarily having to submit and enact a PIP. It may increase the administrative burden because it may incentivize organizations to put more work into the determining reasonableness process. So maybe a bit of a trade-off there on the administrative burden. Any questions or comments about indeterminate growth in this proposed change? Okay, great. Let's go to the next slide. I see support in the chat. Thanks, everyone. Okay, so frontline workforce costs. So context for this, we had House Bill 2045 in a previous session that added a good reason or an acceptable reason for cost growth for provider organizations to the cost growth target program related to frontline workforce costs. In the feedback that we've received, and we heard this from quite a few folks across a variety of provider organizations, commenters requested that provider organizations would be required to report the total amount of aggregate compensation and that OHA calculate adjusted cost growth. Our previous proposal was that it would not be a required report, that it would be an opt-in, so that if a provider organization wanted to say the reason that I'm above the cost growth target in the determining reasonableness process is because of my frontline workforce costs, then they could submit the data. We were really trying to be careful about administrative burden, creating new reporting requirements for provider organizations that did not have there are no current provider reporting requirements in the cost growth target program, and this was going to be a new one that would apply to all cost growth target providers. There's 51 organizations in the state currently, and we were really trying to be sensitive to that administrative burden. We have heard very clearly in the public comments that you've all submitted that you want this to be a required report. So our proposal, again, being mindful of that administrative burden, we are proposing that large and mid-sized provider organizations are required to report frontline workforce compensation as per House Bill 2045. Smaller provider organizations can opt in, and they can opt in as sort of a default, like we will participate in this program and this reporting, or opt in as part of determining reasonableness. We hold our proposal that the data are primarily to discuss reasonableness. They inform the determination of reasonableness conversation, but they cannot be and will not be subtracted from the entity's cost growth. So I think maybe some of the assumptions that we're seeing in public comment is we'll give you a number, you subtract that number out, and that's our new cost growth. That doesn't work, just technically does not work. Because of the data that we're collecting and the difference between attributed total medical expenditures and operating expenses, and where frontline workforce compensation fits as part of operating expenses. So we will collect this data. It will be part of the determining reasonableness process, and in line with the intent of House Bill 2045, no provider will be held accountable if the reason for exceeding the target was frontline workforce compensation. So we hold steady there. We will publish a draft reporting template for this data for the large and mid-sized providers in May. And we did look back, and thanks for the commenters who called this out. There was clear legislative intent in the 2045 process that OHA should collect this data. The template will include some granularity so that we're able to address that legislative intent in understanding what's happening with frontline workforce costs. And we will share that out with you shortly. So acknowledging that this proposal increases administrative burden, and that we are directly responding to comments and trying to create that standardized process for this. And then Deborah, I see your comment in the chat about small providers. So we have sort of thresholds, and these are the same thresholds that we're using in our public reporting. So this could vary by market, and if you are a small provider in one market and a large provider in the other market, I think we'll default to large provider. But we can clarify who is a small and large or mid-sized provider for the purposes of the frontline workforce reporting and push that out. But generally, if you look at our public report and sort of where each organization is grouped on those charts, that's what we would align with here. Thank you team in the chat. And Matt, your question about workers paid by the provider, there is a statutory definition that these are employed workers. And it's total compensation. There's some other statutory definition around this, but it does not include contract workforce. Questions or comments?
Hey, Tara Harrison with Providence. I know we put it in our comment letter a few times, but I just want to go on record here and re-articulate our understanding of the legislative intent and the statutory construction is that, and I understand your comment on the challenges with the calculation, but our understanding of that intent is that this is exempted from the cost growth calculation. It's not a subsequent reasonableness factor.
Thanks for that, Tara. And I think I see comments from James in the chat, and Andrea, I'm sure you want to make a similar comment in addition to whatever else you're going to say. That is not our current interpretation of the statutory language or the legislative intent. The legislative intent does not say, the legislative language, the statutory language does not say subtract from the calculation. It says shall not be held accountable. So again, recognizing, and this is a conversation that we had with the stakeholders and the legislators as this was being drafted during session, that this was technically impossible, that a subtraction in the calculation is not possible in the cost growth target data collection and calculation because we do not measure operating costs. So that has been part of the conversation from the beginning. And maybe there's some missed wires in that conversation, but our interpretation of the intent is that it's shall not be held accountable, will not be held accountable for those costs, not that they're subtracted from the calculation.
Let's hear from Andrea and then Peter.
Thank you. And to echo some of the previous comments, we understand that this is a complex issue, and we really appreciate your consideration of the feedback that you're hearing here and trying to thread the needle, and also your sensitivity to administrative burden, because that problem is real. I want to echo James's comment in the chat that it is the form of accountability to publish an entity's cost growth, and have it, have that sort of public shaming aspect of it, as you all have talked about it in the past. So our interpretation of this is that if you're not going to adjust an entity's cost growth based on this factor before you publish it, then that's not compliant with the language or the intent of the law. And I want to challenge the idea that this is a subtraction from cost growth. I wonder if a better way to think about it would be an adjustment to the cost growth calculation. It seems like if there would be a way to do some calculations to determine that this factor led to reasonable cost growth, and then determine how much cost growth was reasonable as a result of this number, it seems like a similar adjustment could be made on the front end. So I would push back a little bit on the idea that it's impossible to subtract it. And maybe the way to think about it is we need to figure out a way to adjust that cost growth before it is published in a public report.
Appreciate that comment. I would really encourage you and others to submit additional comment in response to this with what that proposal is. And I think if it's language, are we getting hung up on subtract versus adjust versus something else? I would like to know sort of what is the actual proposal that is being made here, because honestly, I have a hard time seeing how we do that sort of mathematically, and I'd love to hear how you're thinking about this. Peter and then Nick.
Yeah, thank you. And I might be just a little slow. I was a little confused by the language here. So frontline workers' wages, which is a critical part of healthcare delivery that everybody pays for, you're saying that is going to be in the cost growth numbers, but then you say you're going to subtract it. So if a system is, above the target, and they say it's because of frontline workers and wages, are they going to be penalized, or are they the words here, they're not accountable for that, which implies they're not going to be penalized for that. And so if you could clear that up, and then my perspective would be, frontline workers, just like every other business, is a critical part of delivery of services. If those costs are going up, maybe there's other places in the organization they can find offsetting savings. So I think they should be accountable for wages, because every other health system is going to have similar issues, and at least in the same marketplaces. So I'm just curious why we're given a buy for frontline workers. I think that's a major cost driver.
Yeah, thanks, Peter. This was a legislative change that was passed in the 2023 session. So this is not a sort of RAC. Okay. This is a legislative change to the program that we are incorporating in rule and figuring out how to operationalize it. But frontline workforce exemption or this frontline workforce cost piece has been added by the legislature. And I think this might be a place where we can continue to try to be really careful about we're all using the same words to mean the same thing. So we measure at the provider level cost growth based on attributed total medical expenses. So how much is the payer being paid for healthcare? We're not measuring operating costs. There are a number of things related to operating costs, including increasing workforce costs, that drive the rates that providers set and how much they are then seeing come through in that total medical expense measurement. So there's a dotted line here. This is connected, but we're sort of talking about apples and oranges. And I think maybe to Andrea's point, there's what we measure and publish in the cost growth report is the total medical expense relative to the target, the percent growth year over year. There are lots of components of that and lots of pieces of that and threads that we might pull on that in the determining reasonableness process. That includes looking at the investments in health equity or the spending on behavioral health and primary care that's happening underneath that. That might include the operating costs relative to frontline worker costs. So I think there's lots of opportunity to discuss and review the data and understand the impact of frontline workforce costs and all the other reasons in the reasonableness list as part of that conversation. But they don't necessarily translate as a subtraction. And I am going to say subtraction because for me, subtraction and adjustment, like I don't want to set the assumption that we're just going to say, all right, I'm making up numbers. Frontline workforce was 50% of your operating costs. And so therefore we're going to do a 25% deflation rate on your cost growth target percentage. I don't see how that works. If that's what you're thinking and that's your proposal, please tell me. I'd really like to think about that some more. But for me, subtraction and adjustment both imply that we are changing the total medical expense value. And I don't know how that works.
Let's hear from Nick and then move on to some more slides given the time. Nick, go ahead, please.
Yeah, thanks. And Tara, I totally agree and hear what you're saying. There's no claim line for cost, right? And so you can't do right. What you're looking on is a set of claim lines, and it's not a dollar for dollar kind of thing. So I get that. I guess I would still, and I will have to think about what that equation looks like. I would advocate for some kind of adjustment factor, definitely not a subtraction, because I totally see how that doesn't work. But just specific to that, recognizing that we can't just do a straight up subtraction. In a way, this seems like the worst of both worlds, which is the administrative burden of required reporting when we don't know what we're going to do with it necessarily. So, I mean, I would at least argue that we don't strike the I mean, if we figure out a way to adjust, great. But if we're not going to, and it has to be as part of the other process, then let's take out the yearly requirement if we're not going to even if everything's good and we come in underneath, great. Then why did we just pull all this data and report it, right? That's just useless admin time.
Yeah, thanks for that, Nick. That was our starting proposal. So I really look forward to a lot of comments coming in the next week or so about this specifically. So please, if you have ideas about an adjustment formula or ideas about how this actually works in operation, please let us know.
Yeah, this one is just worst of both worlds in a way, it feels like to me. So let's not do this.
All right, let's go to the next slide.
Yeah.
I have a couple more updates, proposals that we want to share. So related to the reasonableness document, sub-regulatory guidance, and all of the content in there, we had a number of questions that came in public comment about what happens if only some of the cost growth is found to be reasonable. So there's a good reason that explains part of the overage, but not all of the overage. Does it get subtracted? Then what? How does that all play out? So we are clarifying, and we will tighten language in the drafts where needed, that all of the cost growth above the target must be found to have a reasonable cause to then not be subject to PIPs and penalties. So there was a little bit of well, if some of our overage is only some of our overage related to the PIP and some isn't, how does that all work? So clarifying here that this is an all or nothing. If all of the cost growth over the target is explainable, then no PIPs, no penalties. Next, let me just add one more and then stop again for questions. So we also, just recognizing there were a lot of places where people asked for clarification or asked about what something meant and related to the sub-regulatory draft. We did not put that draft red line out for today's meeting. We will do that afterwards. We are making many of these changes to clarify language or intent or how the process works, and we will have that posted in the next couple weeks. Nick and then Paul.
Thanks. For the previous slide, I would just advocate for flipping that it should be, I mean, my sense is, and just to use a round number, right? So if we're 3.5% and it's 0.2% of unreasonable cost and 3.3% of, math is hard, 3.3% of totally reasonable explainable cost, that still generates a PIP. That feels, I mean, I don't know, that feels somewhat counter to kind of the spirit of this. Whether it's the full 3.4 or at least 50, maybe it's a threshold in between of 50% of the overage or the kind of that whole 3.4. It just feels that a small the way it's written right now, a small fraction, a tiny fraction that just pushes you over the margin triggers all of this feels a little undue.
Thanks, Nick. Paul?
So kind of a similar thought where I do struggle with the thought of assessing a penalty on growth that has been determined to be reasonable or acceptable. And to me, it starts changing this into, hey, you just need to avoid any cost increase, even if there is the potential for, improving patient care, improving quality, improving access, because you're not going to get credit for it potentially. And that just seems, again, a situation where you are assessed a penalty on growth that everybody believes is acceptable. That's a tough place, I think, for an entity to make decisions around.
Thanks, Paul. Tara?
Yeah, I'll be quick. I completely agree with Paul here. I think about it in the context of legislative mandates, for example, which are considered reasonable cost growth. They're completely beyond our control. But if you have a bunch of those 1 year and yet maybe 10% of your overage is found to be an unreasonable cause of cost growth, then we're penalized for all of those legislative mandates plus our 10% because it's all or nothing. That just doesn't make sense. It should be just based on the aspect of it that was found to be unreasonable.
And let me say that maybe I've misunderstood some of the public comment, and let me own that if that's possible. So please let me know where I've got this wrong in your next batch. But I interpreted some of the comments that came in as sort of anything over 3.4. So say an entity came in at 7% for the year that we're talking about. And so they were saying, okay, we can get from 7 to 5, that's reasonable, but we're still at 5 relative to 3.4. And so I think when I'm saying all or nothing, I mean everything above 3.4. And I hear what you're saying is sort of everything from 0 to 3.4 and then above 3.4. So I think what I was hearing was sort of you chip away down from everything above 3.4%. Is that not what the previous submitted comments were getting at?
So I think what we're asking for is, so if you're saying up to 5% was reasonable, but 5 to 7% is unreasonable, then it's just that 2% where the PIP and the penalty would apply, not the gap in between that was found to be reasonable.
And sorry, I'm trying to make sure that we're all on the same page. I think it's the PIP applies, yes, in that scenario, but not that the PIP is designed to then get you from 5% to 0%. Is that what you're saying?
I guess what I'm saying is the PIP would apply because under a PIP, right, an entity is responsible for understanding the causes for the cost growth and then kind of mitigating those causes going forward or remediating. But that should just be on those unreasonable causes, not on the reasonable causes.
Agreed. And I think if that needs to be clarified, that the PIP focuses on the unreasonable causes.
But
well, actually, sorry. Let me take that back. I think what we've seen in the one example of a PIP from Massachusetts is it was up to the entity that was placed on a PIP to decide how they were going to come into compliance with the cost growth target in the future. And there was no specificity whether or not they were working on reasonable costs or unreasonable costs. They were just going to meet the cost growth target in the future. So I know that we're getting close to time here, so I want to just recognize that maybe I did not understand the previous comments, and so really look forward to additional clarification, comments, concerns about this proposal that you want to share with us to help explain, especially if it's explaining your previously submitted comments on this point. So let's go to the changes to the draft rules real quick. Let's go ahead 2 slides, please, Christy. One more slide. So just a little bit of housekeeping. The complete draft rule set was posted for meeting 4. You can find the link online, and it's also, Christy added it to the chat at the beginning of the meeting. The red line changes in this draft are the changes made to the previously published draft rules in March. So there were the changes between the meeting 2 and 3 are no longer redlined, just the changes between meeting 3 and 4. There are some additional pieces of content that are still coming. We know that there are questions and sort of reserving the right to comment on the contested case hearing and the appeals process. And so understood, we welcome that in the future. Next slide. As Zachary mentioned, we also wanted to share with you all today the draft statement of need and fiscal impact for input. This is part of the rulemaking process. Next slide. So the draft documents have also been posted for RAC meeting 4. They include the fiscal and economic impact and the statement of cost compliance, which does get at some of this potential administrative burden for payers and providers. Your input is welcome on this. These are documents that get filed along with the rules as part of the whole package. So if you have feedback on this, let us know. We'll accept that as part of comments as well. Next slide. As always, we really encourage you to provide comments in writing, and the written comments are posted. It's very helpful for us to have those, have that documentation, understand the concerns, the comments, and at this point, specific language changes, specific proposals. The more concrete you can be in those written comments, the better. But we really value those written comments, and thank you for the time that you're taking to provide them as part of this rulemaking process. Next slide. As a due date, we are asking for your written input by April 24th. So that's next Wednesday, so that we can incorporate edits into drafts for the May RAC meeting, the 5th and final RAC meeting. That said, we will continue to accept public comment throughout this process. So that's not a deadline and then you can never provide public comment again. But in terms of our iterating on drafts, it will be most helpful to receive that from you by April 24th so that you can see any changes or we get to have the chance to incorporate those thoughts before the 5th RAC meeting. All right. And finally, with just a couple minutes left, do we have anybody today who would like to submit public comment? I'm not seeing any hands or any chats. I think most people here are RAC members. Last call for public comment. All right, I'm seeing none. So let's go to the last slide, please, Christy. Just a reminder, the 5th RAC meeting is May 15th from 1 to 2:30. It is a virtual meeting, so same time, same place, all of that. We look forward to hearing from you between now and April 24th. And I think, Zachary, do you have any final comments? Do we want to address anything else from the chat in our closing?
Just that I'm seeing some questions and some comments in the chat about this unreasonable versus how far over the 3.4% target, et cetera. So what we can do is put together some examples. I think some illustrative examples will really help ground the conversation for the May RAC meeting. So we'll commit to that, as well as a lot of other documents that we're gonna post too. So stay tuned.
All right. Any final comments from anybody? All right, we will end a few minutes early then. Thank you so much for your participation and all the really rich feedback and discussion. This is a complicated, thorny topic, and we really appreciate your commitment to working through this with us. Thanks so much, everybody.
Thanks, everyone.
Thanks all.